Thank you very much, Caitlin, for starting the recording. That's great. And also, just to let you all know, as we move along, we're going to be having a quick presentation today by Claire Grace, and then we have several of your peers from from 3 different states, and we're going to be doing a panel discussion about collaboration, specifically about collaborating across state agencies. All right, why don't we go to the next slide? Thank you. So we are the Children's Safety Network. And as you can see about what's circled here, these are all the different things that we do as part of CSN. And specifically, this state technical assistance webinar is one of the things that we do for our Child Safety Learning Collaborative. So many, but not all of you are part of one of the topic teams for the CSLC. But I know that others might just be working for your state health department or working for a state organization that does something in prevention, or a partner or a local community organization, and you're all welcome today. So thank you. Next slide, please. Okay, so just quickly, we are funded by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. We always just put this disclaimer up that the information and content and conclusions are ours and shouldn't be construed as the official position of the federal government. So next slide, please. So we're hoping that this will be an engaging, interactive, interesting kind of an event. That's what we aim for. So we're happy that all of you have already started typing stuff into the chat. There will be an opportunity later to unmute yourselves and speak up and ask questions or participate. It's great if you can all stay muted when you're not speaking, but we do hope we get to hear your voices later. If you want to keep your camera on, that's great. And if you can't because you have crazy wild things happening behind you, we totally understand. It would be great if you could turn it on when you're participating. You can turn closed captions on if you'd like, and please rename yourself with your state abbreviation after your name, just so we can see where everybody's from. And next slide. Here are our community guidelines that we always post in our webinars. We just ask everybody to be intentional and focused today. Yeah, we ask everybody to be intentional and focused today, to bring a curious stance. Our motto for the CSLC is I'll teach, I'll learn. So we hope that this will be an opportunity for all of you to learn and maybe to share some of your experiences with others. And we do have a very quick poll thank you for the reminder, Jenny. If everybody could please just answer this poll, we just need to get this information for our own records. We just want to know who's in the room, what kind of organization you're here from. So if you wouldn't mind just quickly answering the poll, it should have shown up on your screen, and we'll just give people like 2 minutes to do the poll. Hope everybody sees it. Oh, it looks like people are responding, maybe. Great. If you could just, looks like most people are from government agencies. I can actually see the poll results. I don't think everybody else can. But it looks like most people are from government agencies, but not all. So why don't we give people like 10 more seconds? Maybe we can get 1 or 2 more responses. Okay, I think we're good. Thank you, Caitlin. You can take that down. So what we're going to do now is I'm going to introduce my colleague, Claire Grace Jones. Claire Grace, people probably know you because you're also one of the co-managers for CSLC. Claire Grace is also our slide designer, webinar developer extraordinaire. She has great skills in that. And sometimes when we have really cute slides or really cool pictures, I always say, thank you, Claire Grace. And she's going to lead this part of our conversation today. So I'll let you take it away.
Thanks, Lauren. So we wanted to start out by just getting a sense of where everybody is coming in from. And so we've created this Padlet, which the link is going to be posted in the chat, or you can use the QR code to navigate to it. We're just going to give everybody a few minutes to share how collaborating across state agencies benefits your work, what barriers and challenges you may have faced or be facing in being able to advance that kind of collaboration. And if you've got any previous strategies that you tried or successes that you would like to share. And so I'm going to stop the share, and Lauren is going to share her screen so that we can also all see the responses in real time here. And if you aren't able to access the Padlet, also please, and throughout, please feel free to share in the chat. One of the things that I love about the STAWs is, we've really designed them to, again, it's, I'll teach, I'll learn. We want to hear from you. So please feel free to share in the chat throughout as well. Um, and so, great. So we've got one response already about, that you wouldn't be able to do this work without your partners. Um, so I'm gonna give just a minute because I know sometimes it's hard to think and write your answer while someone's reading what's already been there. So I'm gonna give just a minute for folks to go ahead and answer some of those questions. And again, you can also feel free to share in the chat. I'll give just another minute because it looks like we've got a few responses for the first couple questions, and people may have not gotten to the third one yet. Oh, great. So I'll give just another minute or two here.
I love people's animal names, like the nervous dolphin. That's
Yes,
like
this
my
is
favorite part
anonymous,
of this.
which is nice.
Yeah. You've got an adorable hamster, a helpful seahorse.
So I'm going to go ahead and just kind of share out a few of these, but please feel free to keep populating them. The other thing that I love, and some people have already noticed and taken advantage of the way that I've set up the Padlet, you can also comment or you can like or respond to other people's shares as well. And so people are talking about the benefits being that you can reach more people across the state and having people with different specialties who work with different populations, increased awareness of programming, not duplicating the work, which is great, strengthening outcomes with internal collaboration. And then we've got some plus ones to that. Similar focus areas across agencies. So working together again to avoid duplication, making greater impact. These are great, increasing reach, finding out barriers that others have already faced. So these are great. I encourage you. This Padlet will persist, and so you can also feel free after the webinar today if you want to go in and read some things that people have posted or continue to add anything. You're more than welcome. But we've got, people being appreciative that they already have great collaboration. Working around schedules can be challenging, and that workflows might vary by agency. Sometimes it seems like extra work for folks, which can be challenging. Siloed efforts, which we hear that a lot, that, sometimes it's challenging because folks are kind of working in their silos. It can be challenging to get data agreements in place or to collaborate around data. This is really helpful. So, setting out realistic expectations and staffing changes, getting buy-in when you have different focuses to your work. Challenges with partners between seeing the connections with their work, with the topic areas that you're working on. And then things people have tried have been successful, including partners from other state agencies on their collaborative children's safety learning collaborative team, coalitions that bring partners, including programs and state departments together, developing charters to guide cross-functional work. Ooh, we'd love to hear whoever the confident goldfish is. We'd love to hear more about that, maybe in just a minute. Showing up for them, they show up for us, and developing MOUs and partnerships. These are really helpful. We're going to talk about those coming up also. And so, again, I'd love when we get to that point to have some folks share about what this has looked like in practice. So thank you. So Lauren, if you want to stop your share, and I'm just double checking. Okay, I don't see any more comments. So I'm going to bring back up the slides. Whoops, that's not the slides. Okay. Let me bring back up the slides. And so I'm going to talk just a little bit about kind of some foundational things around identifying and building these collaborative efforts across, divisions and departments at the state level. And then again, as Lauren said, we're so excited to have three CSLC members to talk about what this really looks like. And I really encourage you to, put things in the chat and to feel free to unmute and share your questions throughout. Don't feel like you have to wait till the end. So I think we know a lot of these already. I mean, obviously, there's a lot of benefits to collaborating. Saw many of those in the Padlet as far as having greater impact, being able to share data, communicating, thinking about how we can be communicating complex public health information, reducing duplication, and also building buy-in and sustainability. Anytime you're bringing in additional partners into the things that you're working on, you're helping them to see the why behind why you're doing what you're doing. They get to be part of some of the planning and decision making, and all of those things can really build that buy-in and hopefully potentially also build opportunities for sustainability. So when you think about identifying who these partners could be, I'm sure those of you who have been on some of our webinars before or have been, in the topic teams that I get to work with, I spent a lot of years doing coalition work before I then worked at the state public health level and have been doing also training and technical assistance at the state level. And I always found it really interesting that I would work with coalitions or I would work with people who were, working on projects or funding that required collaboration. And often I would hear people say, well, we need 10 more members to be, in our coalition, or, we really want somebody, that's connected to the schools to be in our effort. And that's great, but what I have found to be most successful is when you can start with what the need is, and so the more specific that you can get on what it is that you need, the more likely you are to find a partner who is going to be able to fill that gap and match that need. And so even saying, we want somebody from the school system to be involved. Well, do you want somebody that it has decision-making power at the school district, or do you need somebody who can be informing you about what is going on the ground day to day with that population? And so those might be two very different people. You might be talking about, the superintendent, or you might be talking about somebody who is a bus driver or is the secretary or the school nurse or whoever it might be. And so again, the more you can drill that down, the better fit that you're going to be able to have. And so some of the questions that you want to ask as you're identifying, what is it you need, you want to be thinking about, who's touching the populations that you want to reach. And so if you're working in sudden unexpected infant death and you want to be reaching parents that have children under the age of 1, who are the other divisions and departments that also touch those populations? And they might be ones that you, off the top of your head, we know we want to collaborate with our WIC folks and we want to collaborate with our home visiting folks. But, also, thinking even broader than that, who are some folks that maybe aren't working super specifically on a very similar topic, but they're reaching the same population that you are reaching, and there might be a way for you to do some collaboration or some shared messaging. Who has resources and who has related outcomes? So again, it might be that somebody's outcome is, also related to healthy youth, even though it's not the very specific outcome that you're working on, and they might be willing to collaborate because the work that they could do together with you will also help them reach their outcomes. You could look to identify who's working on similar risk and protective factors. So who is working on increasing communication between parents and children, who's working on school age children and, behavior and things like that. So what are those similar risk and protective factors, which again, on the surface, you may not think that, my working in bullying prevention is connected with this other department that is working on, something that maybe at first glance doesn't seem related. And yet maybe they're trying to address a similar risk factor or a similar protective factor that would benefit both of your work. Who has mission and vision that aligns with yours, and who can bring a new or fresh perspective. And then when you've identified these, we have a tool, and I don't know if we've actually linked it, but we can share this as part of the follow-up. But we have some tools that we've created, and we're going to also share some tools that were created by Prevention Solutions that can help identify partners, help you think through making the ask. We're also going to talk a little bit in a minute about levels of collaboration. And so when it comes to making the ask, again, being able to identify what the need is, brainstorm who those potential partners are, and then get real specific. How can they fill that gap? What is it that you're looking for them to do? And being able to communicate what the value for that partner is. We're reaching the same audience, we're working on shared risk factors that we can both be addressing to make a greater impact. And so being able to communicate kind of that what's in it for them or what's the win-win here for them. Being really clear about what the commitment is that you're asking for. I know that we probably all appreciate this, right? Everybody is very busy and has lots of competing priorities. And what we often hear as a barrier or a challenge is that people feel like they already have too much on their plate. And so being able to say, here's the win-win for you. And also, here's the commitment that I'm asking for. I'm asking for you to join this particular meeting once a month and to bring your insight. Or I'm asking if you would just come to a couple of initial planning meetings that we're having to share some data with us that we think would be really helpful in our planning and decision making. And so be really clear. And then thinking about how you're going to make that connection. Is it easiest that you are going to be the person that's just going to reach out by email? Do you have a person in common that I could say, hey, Lauren, I know that you've, worked with Beth from North Dakota before, and, would you mind connecting us and helping me make this ask? I know that when I was working in the Midwest doing prevention, there were times that, I was trying to get somebody involved in some coalition we were working that we knew would be a really strong partner and had some things that we were really hoping they would bring to the table. I had emailed them several times, no response, no answer. But I realized that somebody that I worked with from the school district had an existing relationship with this person from a foundation at the community level. And so I asked her, I said, could you make this invite for this person to come to a meeting and to hear about what we're working on? And she was happy to do it. And I was like, great. It didn't hurt my feelings that this person wasn't even sure who I was. And my email was not a priority for them. But when this other person that they had done some other collaboratively funded projects with together before reached out, they replied right away and said, oh my gosh, of course I'd be happy to be involved. And so that person ended up being a really strong partner. And then, some room here just to think about, next steps. So did they respond? What do you need to do next? And then once you've got all these partners at the table, thinking about, what are those levels of collaboration? And is there a space that you want to be kind of moving people up or sometimes even down from this level of collaboration? When we talk about levels of collaboration, there isn't this I think sometimes there's this feeling that we need to always be moving people to from networking to full collaboration. And maybe that's not the case. Maybe you have a really solid partner who just being able to share information with them through networking is exactly the sweet spot and right where you need to be. But maybe you have somebody that you're already networking with that you have a lot of alignment in the things that you're doing, and you'd like to be able to move to some more cooperation where you're supporting one another's activities. There's a little more frequent communication here. Things are a little bit more defined. Maybe you're interested in moving more toward coordination, where you're starting to actually have a more coordinated effort in planning projects together, thinking about, I was planning to do this, and this is in my work plan. You're planning to this, and this is in your work plan. How can we look at how those two could fit together so that we can be doing this work together? And then full collaboration, where maybe you have even more formal agreements. You've written things into each other's work plans to benefit both of your projects. And you're really working on some real capacity building to achieve a shared vision. Maybe you have shared outcomes or shared goals working together. And that, again, might include more formal links or roles. And there is a lot of trust over time that is built into that relationship. This also gives you a little example of what some of those might look like. So, networking. Maybe this is just that we're in another collaborative meeting together. We're sharing what we're doing. I'm just telling you about programs that we have going on. I get to learn about things that you're doing. We move that to collaboration, where you're publicizing events that I'm having. I may be able to put a flyer about something that I'm doing into something that you're already sending out, or maybe I want to do a questionnaire to find out more about the barriers with a particular impacted population that I want to reach. And I know that you have regular communication with partners that fall into that age range all the time. And so maybe you're able to send that, survey link, a questionnaire link on my behalf with folks that you're already reaching. So all it takes is you kind of sending that off, but we're working together to make that happen. Coordination, again, this is the point at which we're looking to do things together. We're, maybe co-working on a campaign, co-leading some things together, and then full collaboration, where there's much more of that. We're planning things together. We're wanting to make sure that we're in alignment to reach our outcomes. Anybody, I'm going to pause for just a second and to see anybody have any thoughts about this, where they've seen, this kind of work, where you've been able to kind of move into an expanded level of collaboration with a partner, and that's really brought some good outcomes.
And you can feel free to type in the chat, or you can just unmute yourself. We're happy to hear from you.
Could you please put the link for the levels of collaboration in the chat so that
Yep.
I can copy it for a reference?
Yep, I think Jenny just put that in the chat. And I'm also going to share a couple of other resources in just a minute. Thank you for asking.
Okay. I'm trying to establish working with the Department of Education on their bullying prevention, because they have a huge, wonderful thing all set up, but they lost 5 out of 6 of their staff. And so if I can bring this to them and say, at what level do you want me to help you?
I love that. Like, so transparent, right? Like, let's be really clear from the beginning what I'm asking of you and what you're even able to offer. I think that is incredibly helpful and such a good way to start out, or even an existing partnership. Sometimes you have a partner that just maybe hasn't been as communicative, recently. And, this is a great opportunity to just touch base and say, hey, I just want to be on the same page with, where your capacity's at, and what is going to work best for you. And also, Joanne, I'd imagine that thinking about that, what's in it for them, if they've just lost 5 staff, if there are things that, you're able then to have some collaboration around, that you're doing that fits with things that are also, their goals, their outcomes, like that feels like a win-win for them as well. Awesome. And just a few more things, and some of these have come up, and I'm also, I would love folks to share in the chat if you can think of others. But I do think, it's interesting you mentioned Department of Education. So I find sometimes that when we are, I actually came from an education background in the beginning. Then I've done a lot of work with public health. And so I always find it interesting when sometimes we're talking about the same things, but we're using different language. And so it can be really helpful whether you're just establishing this partnership or whether you're wanting to kind of like reinvigorate it or move it forward. to be really explicit about that. You know, when we say this is what we mean, or can we agree together on what terminology we're going to use when we're working together? That can be really helpful. It can be really helpful to create some shared aims and goals and action steps. So I've got my work plan here, and you've got your work plan here, but let's sit down together and create, even if it's a little more informal, or maybe it's helpful to be formalized, where you say, here's what we want to work on together. Here's the goal of our work. Here's what we're going to do to get there. And you might want to even get as formal as creating a memorandum of understanding, or you may need to have a data sharing agreement to be able to share data back and forth. I'd love if there's anybody on the call that wants to unmute or wants to share in the chat any challenges or successes that you've had. I think one barrier sometimes with that is it can take a very long time, especially at the state level, to get a data sharing agreement in place, but sometimes it can be well worth the effort to be able to do that. And while I'm just going to skip ahead one more slide here, because this is my last slide, while people are maybe thinking, or if there's anything that you want to share in the chat around things that you have found really helpful for increasing collaboration and getting on the same page with folks. So here's a few additional resources. These are from Prevention Solutions at here at EDC, which CSN is housed at EDC. And so I picked out a couple. I really like these ones: beginning your collaboration, growing your collaboration, evaluating your current collaboration. But from where all of these are linked, they actually have an entire collaboration toolkit that has a lot of different resources and some stories and some things like that that might be beneficial for folks. And then I also wanted to highlight this resource that was created by the Children's Safety Now Alliance, which also is funded by HRSA, and CSN leads that national alliance with lots of partners and experts. It's an amazing group, and they worked jointly together to create this resource, resources for partnering with federally funded programs. And we'll make sure that thank you. And the link is in the chat. So I'm going to pause for just a minute. I actually can't see anything to have any idea how we're doing on time. But I'm going to pause for just a second to see if there were any questions or comments.
And we are spot on with time. So this is awesome. And Joanne just put a comment in the chat about data sharing. That data sharing, even between state DHHS departments, is difficult when developing a data sharing agreement. It can take nearly a year. But that they are allowed to share aggregated data without an agreement. So that's interesting.
Great. Yeah, and that seems like a great conversation of, here's what we can share now, or here's, how I might be able to share something while we work toward, potentially being able to share in other ways. So that's really helpful. Thank you. Well, keep the questions and comments coming. And in the meantime, I am going to hand it back over to Lauren to introduce and facilitate our panel discussion. And Lauren, do you want me to keep this up for a minute while you introduce folks, or would you like me to just stop the share?
Sure, you can keep it up for just a minute. Okay. That's fine. I just like the images that we have roughly representing our 3 states who are going to be having here to present today. Thank you, Claire Grace, for that great presentation. I think it was a great introduction to what we're going to be talking about now. As I said before, I'm the topic lead for bullying prevention. As I started talking to the states and jurisdictions who are part of our team, of the topic team, I realized that even though generally the people who are participating in the CSLC are housed in the health department or Department of Public Health or whatever it is in your state, when you talk about bullying, you're actually talking about young people. And when you're talking about kids, they are, they're in schools. And so partnering with the education department, or at least finding out from the Department of Education what the data is and what there is to learn, what you need to know to understand the landscape of bullying in your state is really important. So when we were talking about collaboration as a team, as our co-manager team, I thought, well, that would actually make sense. And we were very happy to talk for several of us to nominate states from our teams from our cohorts who are going to talk a little bit today. So we have speakers here from Colorado, Vermont, and North Dakota. So I think now, why don't we stop sharing the screen and then we can spotlight our panelists. So we have here Emma Bernick from Colorado, Beth Ostrick from North Dakota, Kana Zink and Julia Saracen from Vermont. And thank you, Caitlin, for spotlighting everyone. And rather than getting into introductions myself, I think what I'm going to do is ask my first question and ask people to introduce themselves as they are answering, just to say, what state you're from, where you work, and what your role is. That would be great. So the first question I have for all of you is just in a few sentences, if you could please share what you're aiming to accomplish with your CSLC related work and like where you are in the process. I know some of you are new to the collaborative this year, so you might just be starting out. Others have been doing this work for longer, so you might be in a more of an implementation phase. So if you could just say a little bit more about where you are in the process and then how collaboration across state agencies fits in with your work. So why don't I hand it over first to Emma, since you're next to me on my screen. So you can just unmute yourself.
Thank you so much, Lauren. Hi, everyone. My name is Emma Bernick, and I am the Injury and Violence Prevention Planner at El Paso County Public Health, which is in Colorado Springs, Colorado. So we're actually on the local side, not the statewide side, but we are big collaborators over here. It's probably one of my favorite things about working within public health. And I think one of our biggest goals with joining the CSLC as the state of Colorado was to increase that collaboration across the state. We are very, very geographically spread out, which can make collaboration a challenge here. And then also just having such a wide variety of state agencies that are stakeholders within child safety work. So we thought the CSLC would be a great opportunity to kind of bring all of those stakeholders together in one place, and then also recognize what are we doing in different communities within Colorado that can be replicated in other counties or other areas. And then also not wanting to feel like we always have to reinvent the wheel, and recognizing that a lot of us have already established work that we know works well in Colorado and can be replicated in other areas of the state.
Thank you. Great. And Beth, why don't you share a little bit about who you are, the work that you're doing, which topic you're on, and kind of where you're at in the work.
Yeah, Beth Ostrich. I'm with the North Dakota Department of Health and Human Services, and we are actively working to reduce SUID, or sudden unexpected infant death, related fatalities among infants under 12 months of age, with a strong focus on among infants residing on tribal lands. So with that, we're right in the middle of it. This is our second round for the cohort, and we are working on enhancing a lot of work through our maternal and child health infant domain now, through our Cribs for Kids distribution sites. We've launched a Safe Sleep Awareness campaign statewide that is focused on fathers, grandparents, and mothers. And we've also implemented a pilot project aimed at preventing SUID, which is distributing safe sleep resources and bedside sleepers in our highest risk areas across the state. And this initiative, we acknowledge the impact of historical trauma and recognizing the deep culture and emotional importance of keeping those infants safe to their caregivers. So we're trying to offer solutions that honor these values. And then collaboration, did you want me to go right into collaboration as well?
Sure. Like, how are you collaborating with other state agencies?
All right, so we collaborate a lot within our state and utilize multiple offices within our HHS agency itself, like our epidemiology office for data, our maternal and child health office for our director. We use and collaborate with our child fatality review manager, and we also are very blessed to have tribal liaisons that work within HHS that help connect us to our tribal areas. Statewide, we work with our state Safe Kids coalitions, our Child Care Aware, which helps integrate our safe sleep education into child care settings, our tribal representatives from 4 reservations where we're focusing our pilot project in. We partner with Families Flourish, which helps us partner on family-centered initiatives and support services. And we are also working on increasing our partnership with our New American populations. All of these together help us build that awareness and ensure that the families, regardless of their background or location, have access to our resources and get the support they need to keep our infants safe.
Thank you. No, that's really great to hear. I wasn't even sure what I'd hear from each of you about specifics of your collaboration. So it's really wonderful to hear about all the different kind of possibilities out there. So I think from the Vermont team, we actually have three people from the Vermont team here. Emily Fredette, Julia Saracen, and Kana Zink. And I think Kana, you were going to start out by introducing your team, everybody's roles, and say a little bit about where you're at in terms of bullying prevention in Vermont and collaboration.
Sure. So I'm Kana Zink. I'm the violence prevention specialist at the Vermont Department of Health, and we are coordinating trainings with youth serving adults on how to recognize signs of bullying and also risk protective factors and supporting those who have caused harm or experienced harm. So we're coordinating with our state school nurse lead consultant and our staff, and also working with youth serving organizations as well. And we're in our planning phase. We had some connections with our agency of education. They recently had some restructuring within their entire staff, and so we've had to kind of restart and reassess our connections with folks. And that's us.
Great, thank you. And maybe Emily and Julia, since you're also spotlighted, you could just share what your roles are with Vermont before we go on to the next step.
So, hi everyone, my name is Julia Saracen. I use she, her pronouns, and I am an injury prevention specialist in our health department's division of family and child health.
Thank you.
And good afternoon, folks. My name is Emily Fredette. I use she, her pronouns, and I am the Injury and Violence Prevention Program Director at the Department of Health Division of Family and Child Health. I'm just here to support the great work of Julia and Kana. You don't need to spotlight me. They're really the brains of this operation for sure. So happy to be here to support.
Thanks. Glad you're here. So I know that all of you are really moving forward with your work, and that collaboration is a central part of that. But I'd love to hear like a little more about if there have been any challenges in terms of collaborating across agencies. And I know, Beth, you were going to start with that. So why don't you start, and then we can see if anyone else has anything to add.
Yes, so one of the biggest challenges within our cohort for SUID is it's been really hard to maintain some consistent contacts through some of our statewide efforts. And so we've experienced some staff transitions within our tribal reservation partnerships. We continue to prioritize building and strengthening these. And over the past few months, we've made some really meaningful progress in this area and have expanded our safe sleep distribution sites across our tribal lands. But having a specific partner to work with in those areas has been hard to maintain. We've also had, as I assume most of the people on this call, some recent changes with federal funding in our states. So we've experienced a loss of a few valued partnerships within our New American Global Refugees in Fargo. And so that was a partnership that was instrumental in reaching our New American communities. But we're now working to establish some new collaborations with a different refugee organization in Grand Forks called Global Friends. And most recently, we're partnering with Save Kids Fargo-Moorhead to help us reach some of those higher risk populations in Fargo-Moorhead as well. So those are some of the big challenges that we've had recently.
Sounds like you had a challenge, but you are finding ways to overcome it and find partners who are willing and able to work with you. I don't know if anyone else wants to say anything. That's great. I don't know if anyone else wants to say anything about a challenge. I know in Vermont you've had quite a few transitions happening. I don't know if you want to say something about that.
Yeah, I can speak some more to that. So one of the transitions that happened in Vermont actually ended up being a benefit to the work of our team. We're in the Division of Family and Child Health, and then we have a Division of Emergency Preparedness and Injury Prevention. And they took the staff members of that injury prevention team and moved them to our injury and violence prevention team in Family and Child Health. And we had identified some partners on that team. Desiree, who's on the call now, works in youth suicide prevention, and we had been doing a cross-divisional collaboration on this work, but now that she's a member of our team over in FCH, we've been working a lot more closely. So I see Desiree's in the chat saying hello, having monthly team meetings to talk about this work and this project specifically, and just really increasing the way that we partner with Desiree and how it supports our work. She brings a lot of institutional knowledge and wisdom to bullying prevention that's been very beneficial to our team. And then There was some changes, as Kana touched on, at the Agency of Education. We had a contact who was very, very enthusiastic about working with us. They were attending calls and giving us a lot of resources. And unfortunately, their position was moved to a different team. But as Kana said, we've been working on a new point of contact and really just building back up that connection, hoping that we get the same level of enthusiasm and interest in our work. But we remain very positive that we'll be able to get back to that level of collaboration.
Thank you. And actually, while I have you, I know you were going to say something about, I know that Claire Grace talked about levels of collaboration, and I thought that was a really good framing because the truth is we don't need everybody to be a full collaborator. We need people, who we work with at different with different functions and different roles. And so I'm wondering if you, Julia or Kana, wanted to say anything about that.
Yeah, I can chat some more about that. So we are currently at cooperation. So we've identified this new point of contact and we've begun partnering to support each other's prevention activities. As I said, we had that barrier with some staff changes. And over the years, the Vermont Department of Health and the Agency of Education have worked very closely together, but not our team and the school health and safety team around bullying prevention specifically. So we've had a bit of a fluctuating relationship, and it's something that we'd really like to get up to full collaboration, but also work to maintain that, kind of pull away from that fluctuation and just really be strong moving forward. So breaking down those silos, setting ourselves up to maintain level of collaboration over time. So whether it's on a different project or over the years, if staff change, like just setting it up that we can really move forward in the future partnering together. As I said, most of the bullying prevention work has lived within the Agency of Education, and we'd like to really bring those public health and behavior change best practices to the conversation. Kana has a lot of knowledge around ways to frame this training and just like ways to connect with the partners to make sure that it makes sense and also just like has meaning to the youth who would be benefiting from this as well.
I think that makes a lot of sense. It's like like you're trying to establish the relationships and sort of establish the structure of collaboration so that whatever project you're working on, it can continue. That's great. Thank you. And Emma, we haven't heard from you much, and I wanted to ask everybody this question, but Emma in particular, about how the collaboration is strengthening the impact of your work or how it's strengthening your ability to sustain it.
Absolutely. Like I said earlier, I love collaboration. It's my favorite part of my job. And I think it is our sustainability plan because we all in public health have this inherent feeling of wanting to do everything. And I think one of the biggest skills that we can give ourselves is to be able to recognize the value of collaboration and how that not only benefits our mental health, but really enhances the impact of our work long term. So I have a couple examples in the two topic areas that Colorado is focused on, which are SUID and then motor vehicle traffic safety. Within motor vehicle traffic safety, we've been starting these really exciting coalition-based opportunities for partners around impaired driving to connect called DUI Task Force. And the one in our area locally already existed when I came into my role, but it was heavily, heavily law enforcement led and law enforcement based. So it was supposed to be this task force that worked together on preventing DUIs, but it essentially was just a time for all the police to come together and share out about DUI calls that they had gone to. And once some prevention partners started getting involved, we saw our law enforcement really take on an interest in investing in the prevention and education side of things. So they've actually allowed us to present about, for example, what upstream prevention looks like and how enforcement is still part of that work, but they're just more on the downstream side, and what the purpose of us addressing upstream risk and protective factors does, not only to prevent DUIs, but ultimately to make law enforcement their jobs easier by getting people or preventing people from getting onto the road unsafely in the first place. And that's resulted in some really positive long-term impacts because we've noticed that as a DUI task force, the group is less interested in investing only in enforcement, but really is starting to identify more prevention-based solutions to impaired driving. So a great success out of that has been over the Thanksgiving weekend, our sheriff's office actually put money towards covering 300 Uber ride credits for people in our community to get a free Uber ride to and from the bars as a goal to prevent impaired driving. I know that's not necessarily child-based, but that was a really big opportunity for us to recognize that law enforcement was really understanding the value of investing both in prevention and enforcement. On more of the child side, in terms of child passenger safety, we were really able to exemplify this with a recent grant opportunity from our state health department and our state Department of Transportation, who gave us a mini grant to start implementing some child passenger safety efforts within our community. And one way that we did that is we got some of our nurse home visitors trained as CPSTs. And that's been a really awesome collaboration because our nurse home visitors have just another level of engagement and relationship building with these families. So we found that a lot of like the safety advice tends to be taken more seriously when it's given by these nurse home visitors because they have that pre-established relationship and they're able to identify any other child safety needs at the time that the car seat is distributed. And then also our maternal and child health program started a really cool resource distribution opportunity specifically for kids with special healthcare needs. And that actually came out of the result of a prevention recommendation from Child Fatality Review. So we reviewed a death where a child with special needs was involved, and then were able to identify that we would recommend sharing this resource. Our MCH program heard about this resource and kind of the story behind it, and then was able to use some of their funding to not only purchase, but then also distribute that resource in the community, along with trainings for law enforcement and first responders about how to respond to a crash where a child with special needs is involved. So I think just being able to bring in all these partners in such a wide variety of capacities has not only strengthened our work, but has certainly made it more sustainable for the long term as well. Because if something were to happen in terms of our staffing, our funding, things like that, we now have these invested partners from law enforcement, from our state health agency, our state health department, or state Department of Transportation that recognize the great work that we've already started and will be able to kind of support it going forward.
Amazing. Thank you for sharing all that. Just as all of you were talking, I heard a few things. I heard, Emma, when you were talking about the partnership with law enforcement, about, it being really a win-win, like what Claire Grace was saying, right? Like, law enforcement tends to focus on enforcement. And so the idea of getting them to start thinking about prevention and looking further upstream is challenging sometimes, but it really is something that makes their jobs easier. And it's great when you can frame it like that and they get it. And I heard relationships and the importance of engaging with people who already have relationships in the communities you're working in. And I also heard you say something about data, about looking at the data that you had around child fatalities and then being able to use what you learned to have that shape a strategy and collaboration. So thank you so much to all of you. I'm hoping that others who are here today will have been thinking about questions they have for all of you, comments about what you've said, or anything that they're doing that's similar that they might want to share. So we're going to open it up now to everyone. We'll keep, yeah, this is great. Thank you. We can keep everybody here. And then if you have any questions for anybody, please feel free to unmute yourself or just type something in the chat, or you can raise your hand if you'd like. I'm looking to see if there's anyone here who wants to share. And also, if any of the three of you, or more of you, four of you who just presented, if you have any comments about anything anyone else said, we're happy to hear from you too. I think you all are doing amazing work. I appreciate what Jenny put in the chat about all the different kinds of cross-sector partnership work that's happening.
Lauren, I wonder too if anybody has any questions for our speakers, if someone's got like a follow-up question about something that they shared, question about something that was shared earlier on the webinar, or, you got, how many people are on? You got 49 of your closest peers here right now. If you've got something related to partnerships that's bubbling for you and you'd like to ask a question about a challenge or something you're working on, now's a great opportunity.
Emma, I see your hand is raised.
Okay, I know I just yapped at you guys for like 2 minutes,
Love
but I
it.
have one other thing to add about collaboration that I feel like has been an additional benefit. And that's that I am a very big fan of meeting the community where they're at. And I think our collaboration opportunities have allowed for that to happen even more so. So, an example related to SUID that happened for us recently is that we were recognizing that safe sleep education was feeling very overwhelming on top of the other topics that were discussed in pediatric and prenatal appointments and at the birth hospital. So we were trying to identify other places to implement that education. And one collaboration that worked out kind of randomly is we were able to set up a safe sleep station in our vital records office. So that's the office where every single family in our county has to come to pick up their child's birth certificate. And then we were already meeting the community where they're at because they have to come there within the first couple weeks of their child's life. And to be honest, they're usually bored. They're sitting there waiting for their appointment. They have nothing really going on. And then that also benefited our vital records office because that staff ended up sharing with me that their job is really challenging in a way that people might not recognize because they have to go from handing someone a birth certificate and saying congratulations to handing someone a death certificate and saying that they're sorry for their loss. And so them being able to be involved in this prevention process, especially because they're the people that have to see these infant death certificates when they occur, has been really beneficial just for that staff's mental health. And then on that same note of meeting the community where they're at, I've done some outreach in our DMV waiting rooms, and that's been really nice for traffic safety because you already have people, again, that captive audience in a place that they are already engaging with a county service on driving. And I've had the DMV staff tell me that they love when I come there because then nobody's staring at them all day. They're looking at me instead. So I think sometimes the collaboration isn't always benefiting them necessarily in like the outcome, but just in their day-to-day work and, having something else to kind of mix it up.
No, that's great. And then their day-to-day work is better, so they engage better with the public, and then everybody's happier and the work happens better. That's awesome. Thank you so much for sharing those examples. I saw a few other people put their cameras on. So I'm wondering if anyone else wanted to share something or ask a question. Jenny.
This is so inspiring, and I think that sometimes we forget how central partnerships are to our work, because we're just constantly having to, in public health, you're always coordinating with others. I am curious though, just hearing about the wide variety, and Joanne, you brought this up earlier about some of the complexities of like developing, some of these data sharing agreements or just, coordination and so forth. Can I hear from some folks about how do you manage like the communication to maintain these partnerships? Is that really cumbersome? Are there easy ways to, keep communication channels open and make sure everybody is on the same page for the work that you're doing together? I've created a stumper, sorry.
I mean, I can share for Vermont, not specific to the data sharing piece, although I do have thoughts on that. Because Vermont is so small and we have a centralized public health system and a centralized education system, like we're all the same people. We were joking earlier about, for example, Julia's collaboration with the Child Fatality Review Team coordinator. Well, that's Julia, right? So we're small and we're all the same people. So we're in spaces together a lot of the time. It's you go to the same 5 meetings and it's the same partner. So that definitely helps. I think for the data sharing piece, at least in Vermont, we have a lot of data use agreements with the Department of Health because we have such a robust health statistics and informatics division. And that really helps us out a lot because we can offer analysis for data sets that we don't own. And so, for example, we did a suicide data linkage project where we had data use agreements with many entities to be able to obtain data related to those who had died by suicide and the interactions they may have had with different entities in the year prior. And it was a mutually beneficial relationship because we were able to get the data and publish this really comprehensive report. But also our analysts were able to analyze other entities' data that they didn't have analyst capacity for. And so that has been something that's been really great. And our data analysts, we have an entire injury data team, and they're really ambitious and, always quick to say, I don't know what we can get, but let's ask. And then going back to how small Vermont is, generally, when you hear from one of us at the health department, chances are you know them, and that relationship and trust is there.
Thank you for sharing that. I think certain things that you're talking about will work within a smaller part of an agency in a larger state. And then, think about being, creative about how things get communicated for like a larger audience. And also I liked what you said about data. I do think that that's one of the things that I know that as some of these teams were starting out with bullying prevention, they needed to find out, well, okay, so what is going on at schools? And so that's the first step, is to get the landscape. And to get the landscape analysis, you really need to get the data and who you're going to ask. So I think that might be another really important point about sharing data across agencies. I think we're going to go back to the last couple of slides. There's still time to ask questions, to type something in the chat if you'd like, to unmute yourself and ask. But we did want to just share that we do have a really brief evaluation. We always you can either go to the link that's in the chat, or you can use the QR code that's on the screen right now. It's just a few questions, and we really do make use of your feedback. It really helps us to plan these events in the future, find out what's relevant to you, and what could really make a difference in your work. And so this is just some information about Children's Safety Network and where you can follow us. And I do want to say a huge thank you to all of our presenters. Well, first of all, to Claire Grace for sort of setting the stage and getting us oriented to collaboration as as a theme for today. And big thanks to our participants from Vermont and Colorado and North Dakota for sharing their stories and their experiences and insights and great ideas. I thought it was really awesome to hear from them. If anyone has any final comments, questions, thoughts, please feel free to type something in the chat. Once again, a big thank you. And we are looking forward to seeing many of you on our topic calls in January. And between now and then, enjoy the holiday season, and we'll look forward to seeing you in 2026.